So I was recently sent this particular video, and as you can see, it's a woman in her late stage pregnancy who is a powerlifter using the powerlifting competition style bench press. And you know me, I've spent the last decade plus advocating for women to train throughout their pregnancies, and this woman is clearly strong and well trained. But I'd like to share a few thoughts on this video from my perspective as a pregnancy and postnatal specialist strength coach who's done this for over a decade now. And I'm going to keep this as short as possible because I've already done videos on powerlifting during pregnancy and training in a supine position or training flat on your back during pregnancy. So if you haven't watched them, head to my YouTube channel to check them out. The link's in my bio. Now, one of the reasons why I tend to err on the side of caution when it comes to training during pregnancy is because I've seen firsthand, working hands-on with women, the negative effects on the mental, emotional, and physical health of those women who experience abdominal separation and pelvic floor dysfunction, or a combination of both, because the statistics show the incidence of pelvic floor dysfunction was approximately 82% among the women who have abdominal separation. And from my perspective, minimizing the impact of abdominal separation during pregnancy is one of the most important things to focus on when training during pregnancy and throughout your whole pregnancy really. But especially when we know that the incidence of abdominal separation is 90+%. But what's most important is the degree of it. As Dr. Angela James explained on the Pregnancy Process podcast, abdominal separation could be muscle stretch, it could be the linea alba stretching and not necessarily tearing. Then sadly for some women, the connective tissue between the abdominals actually tears. Now, the reason why I'm talking about abdominal separation in relation to this particular video is you can clearly see as this woman arches her back to come back into the competition style bench press, or she puts herself into spinal extension, you can clearly see her abdominals peaking. I also know that hyperextension or extension of the spine places increased pressure on the abdominals, and it's extremely difficult to maintain neutral intra-abdominal pressure with no peaking or doming through the abdominals in this position. And we also know as the abdominal pelvic pressure increases, the interrectus distance and pelvic floor dysfunction also increases. Now, the reason why we want to minimize the pressure placed on the abdominals and linea alba and not have them peak and dome like this is to minimize the risk of the linea alba actually tearing, which is where abdominal separation becomes more injury-based. And again, while I'm a huge advocate of training during pregnancy and completely understand, like, you are not fragile, you can train, you want to train to your limits. And again, this woman is clearly very strong, and I think she's actually a powerlifting coach with a reasonably large following on social media. From my perspective in relation to this, I believe that she actually has the responsibility to make sure that she's sending the right message to women. And to be totally honest with you, I'm just not sure using a competition style bench during pregnancy is actually really necessary. I mean, I understand learning how to use your entire body to maximize your bench press is a skill that takes many lifters years to learn. I just don't think if this movement pattern was actually ingrained in your body that you'd forget it in 9 months, right? I mean, I'm not a powerlifter myself, but I do know that exercise variation helps improve your strength in your lifts. I also know that the closer that you get to competition is when you want to make sure that your lifts are very specific to competition lifts. But I doubt that she's close to competing. So again, is this competition style setup really necessary? Would using a slightly more pregnancy friendly standard bench press setup with maybe, I don't know, a 15-degree incline severely impact your strength gains during pregnancy? From my perspective, I don't think so. I mean, I think this would be sending a much better message to women who are pregnant because it's honoring the changes that are happening to your body while also continuing to do what you love. And this makes me start thinking about potential reasons that women resist these changes and kind of refuse to make allowances in their usual habits and routines for their pregnancy. But I think maybe that's a post for another day. Now, in the comment section of this video, there was another school of thought in kind of a similar realm, being that if you were doing it before you fell pregnant, you can continue to do it throughout your pregnancy. And this thinking is flawed, or this advice is flawed, because your physiology during pregnancy is completely different. And there are many, many factors that need to be taken into consideration. And if you use that same kind of logic, to me that's like saying if you drank, smoked and took drugs before you fell pregnant, you can continue doing this while you're pregnant. I don't know any healthcare provider that would give you the thumbs up to continue doing any of those things, right? Now, the reality is pregnancy is roughly 40 weeks, right? In the grand scheme of things, if you're well trained like this woman is, this is such a short time frame that I genuinely believe it's more important to understand where the limits are when it comes to training during pregnancy, so you can return to doing what you love as soon as possible while being in the best possible physical, mental and emotional space. And in my professional experience, having a postpartum period that doesn't include a tear in the connective tissue of your abdominals or pelvic floor dysfunction is absolutely part of the equation. So that's it from me today. I hope this video helped. And of course, if you would like more in-depth pregnancy-specific content, feel free to apply to my complimentary but private community, the Preggy Training Crew. The link is in my bio.